record on this computer. So can I get a thumbs up by everybody that yes, we are good to record this website?
Yes.
Okay, awesome. Thank you. All right. Well, happy hump day. I haven't said that yet, so I wanted to kick off the new year, not just with cannabis, but with Webinar Wednesday being our hump day, middle of the week. We have a really interesting speaker today, Jannabis. Pronounce your last name.
It seems like you got quieter all of a sudden.
Oh, that's weird.
I would agree.
The volume went down.
Yeah. It's like everyone else stayed equally loud, but you got quieter. I'm not sure why.
Is that better?
No, that's not better.
Okay, let me put my headset on. All right, hang on, everybody. That's weird.
Okay, how is that? Is that any better?
Yes.
Okay, good.
Yeah.
All right. So our guest speaker, Jannabis, she is a registered dietitian and also a professor who teaches about cannabis and holistic health. She has a really, really interesting start to this. I am going to let her take over immediately because, like I said, she has a ton of information. So as we normally do at the end, we open it up for Q&A, and we also will have Janice's contact information available if we don't get to everything. So with no further ado, you're going to love what she has to say. It has enlightened me. And take it away, Janice.
Wow, excellent. Thank you. So I'm going to share my screen. Hopefully you can all see that. Thumbs up.
Yep, good to go.
Yes, excellent. Okay. So I'm Janice. I'm a registered dietitian nutritionist. And about 5 years ago, I pivoted my career to become a holistic cannabis practitioner. And I will tell you why I did that. And let's see if this works for me. There we go. Did that work?
Yes.
Yeah.
Good. Okay. So this is my story. My dad had some pretty severe pain from some medical issues and a surgery that didn't go well. And so the doctors gave him all the traditional pain medications, which, you know, is what they do. And he did not like how these medications made him feel. He was groggy and he was so severely constipated that it required a 4-day hospital stay. So I don't have to get into detail, but at the end of this stay, I said to his doctor, isn't there anything else we can do for his pain? And I said, what about medical marijuana? Because I knew that Massachusetts had just passed that law. But truthfully, I used to say, haha, medical marijuana. I did not understand that cannabis could be used medicinally. I didn't. I grew up in the just say no generation, right?
Yeah.
They told me it was bad. They told me it was a gateway drug. So I didn't use it. I really kind of looked down on people who did. I'm not going to lie. So we got my dad certified and I took him to a dispensary. We got him a high CBD vape pen, came home, had lunch. We figured out how to put it together. He took 2 puffs and he stood up he said, I'm going to go take a nap. And I said, okay. And he stood up and he said, wow. And I said, are you okay? Are you dizzy? And he said, I'm not in pain. So on that day, I left my business of 15 years and I went back to school to become a holistic cannabis practitioner. And that's all I have done since 2017. So 4 years.
That is awesome.
Yeah, it was just, I don't know. It was amazing. So stereotypical view of a cannabis user, right? People think, you know, stoners, people just hanging out on their couch and, you know, do nothing. That's what people think. Who's actually using cannabis? Well, if you look at this, look at the 50 to 64-year-olds. Way more of them are using cannabis than the 18 to 29-year-olds, right? People get older and they might have some aches and pains. They might have anxiety and not want to go on anxiety medications. And so they are turning to cannabis and CBD for their issues. So I don't have time to go into all of the history, but I was shocked to learn that cannabis has been used medicinally for thousands of years. And Queen Victoria used cannabis tincture for her menstrual cramps. And
Mhm.
all was good. The doctors carried it in their little medical bags, even in the 1900s, the early 1900s. They carried that. They carried willow bark, which is now aspirin. Cannabis was an ingredient in dozens of patented medications. But in 1930s, cannabis was made illegal, and I don't have time to go into detail, but it was not due to science or medical reasons. It was strictly political and racial reasons. And unfortunately, I have to leave it at that. I usually go into a little more detail, but we really don't have time.
Yeah.
So it's been illegal ever since. It is still federally illegal, even though it's legal in Massachusetts for adult use and medical use and in a lot of states, but federally it remains an illegal substance.
Yeah.
And it's interesting, the New England Journal of Medicine has called for the rescheduling. Most medical professionals, well, especially at the time, because they saw the benefit. Right now, a lot of doctors don't understand because they were never trained in it. I was not trained in it in my internship to be a dietitian. So if medical professionals aren't trained in it, then many of them have the same stigma that I had about the plant. So look at 2003. The US government applied in 1999 for a patent on CBD and cannabinoids as antioxidants and neuroprotectants. And the reason they applied for the patent is that in the late 1990s, these NIH scientists were looking for something that would be good for Alzheimer's, Parkinson's, Huntington's, neurodegenerative diseases. And they found that cannabinoid therapy was the most promising. So they got a patent on this. And yet it is still illegal, which makes no sense at all. Okay, cannabis versus hemp. You've heard of both of them. Hemp is part of the cannabis plant. The difference is that hemp has very, very, very little bit of THC, which is one of the components of the cannabis plant. And it's the one that makes you high or makes you stoned. If taken in excess, THC is not a bad cannabinoid. It's a good cannabinoid. It's much like alcohol. If you have a glass of wine, great, it's good for you. If you have 2 bottles at dinner, probably not so much. Same with cannabis. It's medicinal, used properly. If abused, then it's not so medicinal. So hemp has just a tiny bit of THC. I mentioned that cannabis is federally illegal, but more and more states are allowing it for medical use and also what they call recreational use. I call it adult use. But it's, for me, that there are 13 states that do not allow cannabis for medical use. To me, it's a tragedy. I've worked with clients. I have a client in Georgia who has breast cancer, undergoing chemo, and she cannot legally access cannabis to help with her symptoms, and that is wrong. So cannabis and hemp, there are 3 main components. We have what are called cannabinoids, CBD, THC, and a lot of other cannabinoids, and they all have their own medical value. And we'll talk a little bit about that. But there are also terpenes, and these are the things that give the smell to the plant, and cannabis does have a unique smell to it. But if you smell lavender, you get that kind of calming feeling. That's due to the terpene linalool. Okay, that's in lavender. It's also in cannabis and hemp. So all these terpenes, myrcene is good for a little bit of sedation, limonene is uplifting, beta-caryophyllene, good for pain. So, and then there are flavonoids. I'm a dietitian. I tell my clients, eat a lot of fruits and vegetables, right? They're chock full of flavonoids, right? And it all promotes health. So this is plant-based medicine. It's a green leafy vegetable. So cannabidiol, this is CBD. You've probably all heard of it. Some of the great things about CBD, it can be effective for pain relief. It's a potent anti-inflammatory. So inflammation, whether it's in the brain or in other parts of our body, is a contributor to almost all of our chronic diseases. It is antibacterial. My mom has a wound on her leg right now. She's putting CBD salve on there because there are antibacterial and wound healing properties. Anti-seizure, we actually have an approved drug that is CBD for childhood seizure disorders. It's anti-nausea, it can be an antidepressant, it's a pretty good anti-anxiety, and bingo, neuroprotective. Okay, and we'll get into this a little bit more. Again, THC also provides pain relief, anti-inflammatory, it's anti-spasm. It's also psychotropic, so it can make you a little bit high or euphoric. And honestly, there's really nothing wrong with a little euphoria for someone who's suffering from any kind of medical condition. The entourage effect says that the plant, the power is in the plant, all the different components of the plant. We don't want to pluck out one molecule from the plant. We don't want to pluck out THC. We don't want to pluck out CBD. We want a product that has all the different components of the plant because they work together synergistically. So that's important to remember. So I have to tell you about this. We have, all of us here have what's called the endocannabinoid system. So there are cannabinoids in the plant. In our bodies, we make cannabinoids, right? There are hundreds in the plant. We make at least two. We've researched these two the most. There are many more. Anandamide, it's called the bliss molecule. So if I make a lot of anandamide, my incidence of anxiety and depression is very low. If someone else, maybe Gabby here, doesn't make enough anandamide, she's my intern, so I can use her as an example. So if she doesn't make enough anandamide, she will be at higher risk of anxiety and depression. It's much like thyroid. Some people take thyroid medicine because they don't make enough thyroid hormone. So some people make more of these endocannabinoids, which are good for us, than others. And then we have receptors all throughout our body for these cannabinoids, okay? This is just a picture of where these receptors are. You'll notice in the brain and central nervous system, we have receptors ready to receive cannabinoids, either that we make in our body or from the plant. Okay, briefly, pain. So how does cannabis help with pain? There are two main ways. I told you that it decreases inflammation, cannabis and CBD. It also decreases the signaling of pain. So when we have pain, the pain signal has to travel throughout your body from neuron to neuron. And what cannabis and CBD can do is to decrease the transmission of those pain signals, bringing your pain down. It is not going to take a pain of 10 to a 0. Some studies that I have read showed in a pain clinic, the average pain of 8 was brought down to a 4. 4 is manageable, 8, not so much. CBD can also increase anandamide, which is that compound that I just talked about that we make in our bodies. So you take CBD, your own anandamide level goes up. And that's good for anxiety. It decreases the pain signaling. It also activates serotonin. So serotonin is another one of these feel-good molecules. So CBD can increase serotonin levels as well. Cannabis versus opioids, there is no comparison. Cannabis is not a gateway drug, unlike what I was taught growing up.
Yep.
It could be termed an exit herb. It helps people get off opioids. There was a study in 2016 in giving cannabis to opioid users, decreased their use by 44%. If you can lower how many opioids you take, there is less risk of addiction, there's less risk of overdose. So you can use cannabis and CBD to decrease the opioid dosage during withdrawal to manage symptoms. People say, well, why don't people just get off opioids? Because it is incredibly difficult to do. Your body is physically addicted to the opioids after a certain amount of time. And when you try to get off, you have horrible symptoms and it's hard to do. Cannabis and CBD can help manage those symptoms. It can decrease the anxiety. It can provide some pain relief so that it can help people get off opioids. I prefer the preventative. So before starting opioids, let's try some CBD and cannabis and see if we can get people under control that way without going to opioids. Mental health, I could give a whole talk on CBD and cannabis and mental health, but CBD has been shown to provide relief for PTSD, for phobias, for addiction. I talked a little bit about how it can help with addiction, anxiety and depression, again, increasing anandamide, increasing serotonin. CBD can increase what's called GABA, which is a calming influence on the brain. It's sort of an inhibitory neurotransmitter, whereas there are others that are excitatory. And when you have a brain injury, your body releases glutamate because you have a brain injury and you do need glutamate to help heal it, but it sticks around for a while, and the inflammation in the brain is what can potentially cause long-term effects. Decreasing stress hormones. In this hippocampal neurogenesis, CBD has actually been shown to promote brain cell regeneration, which is a little bit crazy that it can do that, but it can actually help to grow brain cells. A couple of studies have shown that. This was a study in an outpatient psych clinic, and people who had anxiety, insomnia, they were given 25 milligrams of CBD. After I think it was 6 weeks, I have to look that, the sleep improved in 67% of the patients, and anxiety improved in almost 80%. So I always tell my clients, CBD is very, very powerful for many, many people, but it doesn't work for 100% of people for 100% of conditions. Okay, it's not magic, it's not a miracle. Even though some of my clients use that word, it can do a lot of things for a lot of people. Okay, so TBI, the anti-inflammatory and neuroprotective properties of this plant are what are so powerful for concussion TBI. We typically start on high CBD, sometimes exclusively CBD, especially in children. We might add a little bit of THC as well. And there are other cannabinoids that also have anti-inflammatory properties, which again, when I talk to you about, we don't want to pluck one molecule out of the plant, we want whole plant medicine. So when you have a brain injury, there are a couple of things that happen. I told you that the glutamate is released. Cytokines are these inflammatory markers, which again, at the beginning, it's great to have inflammation to help fight this injury, but when it hangs on too long, it can result in cell death, brain cell death. It also causes a constriction of your veins, of your blood vessels, and that can lead to a decrease in blood flow to your brain. So where 2-AG is that second cannabinoid that we make, anandamide is one, 2-AG is the second one. 2-AG is particularly neuroprotective.
Well,
So
what about your legs and arms? Can those, if you get a TBI, can you stop getting blood down to your legs and arms?
well, I'm not sure that they've done research on that to see that it would go that far.
Yeah.
But I do know that cannabis and CBD are what we call vasodilators. So they dilate, they open up your blood vessels, which brings more blood to your brain and more blood to your heart. If someone is very elderly and has very, very low blood pressure, this is one thing we need to be careful of, because by opening up the blood vessels, which is a good thing for 99.9% of people, but if someone has very, very low blood pressure and we open up the blood vessels a little bit, they could get lightheaded. So that's just something that I always look for. This is kind of amazing. They looked at a trauma center and patients who came to the trauma center with TBIs. There were 446 cases. 18% had a positive THC screen on admission. They always take your blood and they look to see. So 18%. The the mortality, so the percent of people who died in the THC positive group was 2.4%. In the THC negative group, 11.5% died.
Wow.
It appeared that THC was protective against trauma and brain injury. Okay, so here is a look at, there were 66 TBI patients and they gave them a tincture of THC and CBD. And they found that 80% experienced significant improvement in activity level and symptoms. In particular, mood improved in 83%, sleep in 76%, headaches in 74%. So this is from the Dent Neurologic Institute.
There we go. I wasn't able to see that last slide.
You were
There we go. Yeah,
there?
that's,
Okay.
yeah, no,
Okay, so here is a study of 4,800 patients, and they were looking at pre-injury use of cannabis and then the outcomes in TBI. Now, this study was done in 21. Remember, the previous study was 2014, and it showed that 18% have had a positive THC screen. In this one, it showed that 28% had a positive. It could be due to the legalization of cannabis around the country, right? So more people had a positive screen, and they found that the THC positive patients had a shorter hospital stay and less time on a ventilator than people who did.
Janice,
Yes,
Janice, just for the record, it looks like you have two slides. One's over imposing on top of the other one. Go forward one. There you go. Now that's the one. I think.
oh, thank you. Thank you for telling me that. You
I was saying before, yeah, I noticed that too.
okay. So Gabby, is that the way it's supposed to look when we did it on our practice?
Yeah, originally that didn't happen in our practice, but yeah, that's what I put in the chat, that it was looking like that, but then once you advanced it was fine. But
Is that good?
yes.
Okay. All right. Sorry about that. So CBD and THC for stroke. So this was a study in mice. So that's a caveat. We obviously need more human studies, but this was, they looked to see if CBD and THC offered this neuroprotective effect in mice that were subjected to a stroke. And they found that these cannabinoids significantly improved stroke outcome. So, and CBD provides this neuroprotection without having to increase the dose over time. So those of you who use THC know that you can use 5 milligrams for a month, but then you develop a tolerance to it. So then you need 8 milligrams and 12 milligrams and 16 and 20. So anyone who uses cannabis or THC, it's important that you take a tolerance break. So every couple of weeks, you really should stop using it to reset your receptors. Okay, so that's some of the research. How do you use this stuff? So you can use sublingual tincture. So you put a tincture under the tongue, you hold it there for a minute or two, and then you swallow it. That's absorbed in about 15 minutes.
Excuse me.
Yes.
I was going to say, how long should a cannabis break be for any individual?
Good question. If you take a break every month, you can just stop for a few days. If you've used for 6 months, you're really gonna have to stop for a couple of weeks to reset your receptors. And then when you go back to it, if your dose was 50 milligrams to get relief and you take 2 weeks off, when you go back, you'll get relief with maybe 15 milligrams. And then you'll have to slowly. So sometimes it's better to do it like 1 or 2 days a week to not use it. Like use it 5 days or 6 days, take a day off, and that will help to reset also. So there are water soluble tinctures also, where you put a few drops in water and you drink it, and that's absorbed even faster than the under the tongue. Capsules or edibles, that has to go through your GI system and get absorbed and go through your liver. And we'll talk about potential drug interactions. That's where you could see that with the edibles or the capsules. Inhalation, so either smoking a joint, using a vaporizer, whether it's vaping dry flower or getting a cartridge. That's another way to get cannabis medicine. Topical creams, this is really effective for a lot of people who have pain in one particular area. Sometimes migraines. I have 2 people with trigeminal neuralgia, which is pain in the face. There's sort of nerve pain in the face, and they put a topical salve and find relief with that.
I'm wondering, I had spinal surgery in the end of May last year, and I'm wondering if a topical solution would work on my lower spine where I had the surgery.
Yeah, is the pain right in that one area?
Yeah.
It's possible a topical would help you then.
Interesting.
Yeah, some people find that, using a topical along with a tincture, so you're sort of attacking it from the outside and the inside is helpful. But some people, I have a guy last week who did a rotator cuff injury, and it's been since September and he hasn't slept, and he came and got salve. He's a local guy. And he emailed me and said, it's the first night I've slept since September. He said, he called it a miracle. He said, it went from shooting pain down my arm to just a dull ache in my arm. So, okay, so this is just the onset, how quickly it takes effect. I mean, ingested edibles, they provide the longest relief, but they take longer to take effect. So if you have episodic pain, like all of a sudden you have a shooting pain, you don't want to take an edible, because it's going to take 90 minutes probably to see an effect. Okay, finding a quality CBD product. This is a problem since the FDA found that about 70% of the products on the market are mislabeled. Some had 0 CBD because it's expensive medicine. It's expensive to organically grow the plant. It's expensive to then dry it and then cure it and then extract it and put it into a use that people can take that is free of heavy metals and all the rest. So, people are going and putting olive oil in a little bottle and calling it CBD oil. So you have to be very careful. You want to make sure that wherever you buy CBD, you ask them for independent lab testing to prove that what they say on the label is actually in there. Full spectrum and broad spectrum. When I talk about the whole plant, full spectrum has all the components of the plant. Broad spectrum has all the components except the THC. Because I have a lot of clients who can't risk a positive drug test, whether they're a truck driver, police, whatever, that they can't risk that. So broad spectrum is better for them. I like organically grown, and I also like grown in the USA personally. Okay, dosing. So this is the challenge, because some people find relief with 2, 3, 5 milligrams of CBD. And some people need 100 milligrams. It really depends on the person and the condition. So what I have people do is start very low and then just we work our way up until they find relief. Yeah. And it can take 2 weeks. I have some patients with GI issues, ulcerative colitis, IBS. It can take 8 weeks to really see the full effect, to get that inflammation under control and really help with that. We talked about tolerance of THC. So drug interactions, if you ingest an edible or a capsule, as I said before, it goes through the liver, it's processed by this enzyme, it's called CYP450, and the same enzyme breaks down some other pharmaceutical medicine. So it's possible, let's say you're taking Coumadin, a blood thinner, and you take that at the same time as a very large dose of CBD. Small doses, this is not an issue. But if you have a big dose of CBD and you take it with your Coumadin, there is a potential that you might interfere with the metabolism, the breaking down of one of them. And so Coumadin is one that we're very careful with, because a blood thinner, you don't want to mess with that. There aren't a lot of drugs that there would be that issue, but I'm always careful. And I look at all the medications that my clients are taking.
I'm very glad you said that, because I do a lot of support services for people that are stroke survivors. And if and then they want to go interact with medical marijuana, I've brought it up in the past because I'm an advocate for this, but it's a dangerous combination of the two.
It can be, absolutely. Yep. You have to be careful. And also with alcohol.
And
you don't want to be drinking a lot of alcohol and using THC, because it'll impair. Okay, so checking with someone who knows what they're talking about is really important. Okay, side effects of CBD. The most common one is people tend to have more vivid dreams. They wake up and they're like, oh my gosh, I remember my dreams last night. The first week or two, some people, and these side effects are not that common. Some people say they felt a little fatigued, and I think that's partly that it's sort of that neurocalming. It kind of brings people, it's like an exhale, and people say, man, I could take a nap.
Yeah.
So low blood pressure, I mentioned that before. Dry mouth, I've never had anyone tell me that they got a dry mouth from CBD. Cannabis, yes, definitely cannabis. I have a lot of people who say that. GI issues, I've only had a couple of people who've told me that when they first start taking CBD, their GI system was a little bit wonky for a few days, but that goes away. The World Health Organization basically says CBD is well tolerated, good safety profile. So pharmaceutical cannabinoids, Marinol, you can get a pharmaceutical THC or CBD, but you are lacking that entourage effect that we talked about, the synergy, the beauty of the plant. You're missing with a pharmaceutical. You have to use a much higher dose of a pharmaceutical, and the side effects are way worse. So I'm not a big pharmaceutical fan, frankly, if you're going to look at cannabinoid medicine. So this is a guy that I work with, and he had a serious TBI. He was surfing, and he's a big surfer, and he says the cardinal rule is when you lose your surfboard, you put your hands over your head. He said, I have no idea why I didn't do that. The board went up, and it came smack down on his head. So he, it took him a long time to recover from this, but he found CBD very helpful because it decreased his anxiety. It's hard to say, well, it decreased his brain inflammation and helped him heal. I believe it did. He believes it did. This is not a controlled study. This is just, an N of one person. But he said the first 24 hours, he didn't have any symptoms. And then 4 days, in the next 4 days, his symptoms peaked. And he said 10 weeks would pass before returning to work. And I spent most of that time away from reading, away from TV and driving. He said the suffering stemmed from the isolation and wondering if I would be in the 2-week or the 3-month recovery period and how long he would be out of work. But he did find it very helpful in his recovery from his TBI. And that's the end. I wanted to leave time for questions. So that was a quick overview. And I know I went kind of fast, so I apologize for that, but that's
wonderful.
There's a lot of info.
I want to kind of kick it off with a couple of questions, and I think this is part of the conversation that you and I have had before, Janice, which speaks to how you also reinforce the need for research. But before I say that, my daughter responds, my oldest daughter with the 6 TBIs responds very much like the surfer. Her first 24 hours, she had, hopefully she doesn't get another one, but no symptoms. And then all of a sudden it hits her like a wall. Whereas my other one, immediate, which takes me to the point of my first question, head hit location. I suspect there's something to that question because in one of the companies that I am beginning to work with to bring clinical trials to our audiences is working first with psilocybin and cannabis, but they're starting first with stroke patients and then they're going into TBI patients. And they are very specifically focused on indications that are at certain locations where the head was hit because of the reproducibility. And in one of the studies that we presented from the data that we have on the dashboard, we were able to identify and also confirm what other research publications have done on suicidal tendencies and where the people were hit on their head. We just don't have a postmortem. Our people are alive and living and trying to improve their lives. These studies were all postmortem. So that speaks to the power of what we're able to do. So have you had any hints about head hit location or kind of stroke, or excuse me, kind of head injury to how you are able to help people with prescriptives?
The short answer is no.
Okay.
No, I have not teased that out. I've probably dealt with about 7 or 8 TBI patients, and that was not anything I thought of dialing into the location. So no.
Okay. And that I think is where we can help, right? It's if we have that question on our app, and a really interesting point was just raised by Michael as well, which is the cost. And Michael, I agree and hear you. The cost associated with any therapeutics for people with brain injuries is usually way out of most people's pockets. Like I had to use credit cards, right? I lost my job. So that's one of the reasons why bringing a clinical trial to the population, you get these services for free and you always get paid for your services as well. And tolerance was an interesting point that you raised, which I don't think we had discussed before too, in the washout period. So this is something that's really well known amongst clinicians and the clinical trial research space. Whenever we change patients and we bring them onto a study, we would always have to make sure there was a certain washout period so that the liver was actually functioning well and able to metabolize. I myself take vitamins every day, but when a bottle gets emptied, I wait a month before I go and buy it again. And it's just out of what I've learned. And this is just supplements. You should always have a washout period for things like that. So that was a really interesting point. And I didn't even think about having to titrate up at those like levels. So I don't want to hog the conversation. Anybody else, please jump in.
I have a question. What
Christine?
about how does it apply to gastroparesis?
Interesting. I'm giving a talk on gut issues, and that is something that I'm doing some research on, gastroparesis, because cannabis does affect the motility of the gut, and it can be helpful. And it's sort of interesting because it can help people who have diarrhea, and it can also help people who are constipated. I have a lot of clients who say to me, geez, since using the CBD, my lifelong constipation has gone away. And they said, oh, you didn't tell me it would help with that. And I said, well, you didn't tell me you were constipated. I mean, you know, so it's interesting because of this, the endocannabinoid system. And I know it sounds a little bit, I don't want to say hokey, but this endocannabinoid system, the goal is homeostasis or balance in the body. So it knows when to sort of open up more receptors when your body needs it, right? So I can tell you that there is some research on gastroparesis. You can check out my website, jannabiswellness.com, and I'm pretty sure I have something on gastroparesis there. If not, Gabby and I will get it there tomorrow.
Thank you.
Sure.
Janice, that was a wonderful presentation. You hit a lot of excellent points all the way around. I wanted to know if I could introduce you to a few doctors that I think they would really benefit talking to you.
Sure, absolutely. Yeah, I do a lot of, I mean, I teach, I have doctors and nurses in my college classes, cannabis therapy, and I love educating healthcare professionals is honestly second to working with my clients, is to me my most important work, because we need to educate them. Because again, 5 years ago, I knew nothing about any of this stuff, zero, because I wasn't taught, and doctors haven't been taught this. Even in med schools today, only 15% of medical schools teach about medical cannabis therapy. It's absolutely, it's infuriating is what it is. But I think some universities, they worry about federal funding because cannabis is illegal. So there are so many issues that are layered on there. So we all really need to advocate to make this plant legal so we can do more rigorous research. I mean, don't get me wrong, there is a lot of research on the medical benefits of this plant. There is a lot in other parts of the country as well as the United States. but we need more. We need more clinical trials so that we can get better information on dosing. You know, after a TBI, I have read something that said it's best to initiate cannabinoid therapy immediately, right? So you get the inflammation and then you want to do that. I have a client, I have a friend who's a colleague. We were interns together way back in the day, and her mother had a stroke and was in a major teaching hospital rehab in this area. And she was on a G tube, right? She was being fed through her stomach by a tube because her stroke was that severe. And my friend wanted her to use CBD because she understands the benefit, right? After a stroke. And of course, what do you think the doctors said?
Absolutely not.
You can't put your CBD in the G tube. Well, guess what my friend did? She went to the president of the hospital and she got permission. And so my CBD oil went into that G tube. And you know, she feels like it helped in her recovery. So
these anecdotal cases, these one-offs can build into a series, right? And that's the start of a pilot study and into clinical trials. I want to ask Jordan, how do you address the cost? Because, and I'm going to let everybody know in our group, Jordan is creating a company around CBD and dispensing, and he's really litigating so that North Carolina will approve it. Because Jordan, can I share, Jordan, your success? Jordan was on 13 medications for all of his problems from his injury, which is very extensive, and he got off all of them, which is unbelievable. We had that kind of experience in our diabetes, type 2 diabetes. When people ate right, they got off all of their medicine. I had patients hugging me, thank you, thank you, thank you. And it wasn't just diabetes medicine, it was their heart medicine as well. And so this is another example. Jordan is a true success story, and I'm sure he had to figure it out, right? But this is why it's so important. And if you want to elaborate upon that, please do so, Jordan, because the other thing I wanted to talk about is clinical trials and how we can maybe kind of push for that too.
So like Janice had pointed out, it's definitely a lack of research worldwide. I spent 2.5 years researching the effects of cannabis use with TBI or cannabis use with strokes because I had both. And I couldn't find anything. I found it was like maybe 3 or 4 different studies, and they were based on the other side of the world. I believe it was out of Europe. I can't remember because it was almost 3 years ago now. But it shown really positive benefits for neuroregenerative repair.
Right.
And that was enough for me to decide to do it myself. I mean, growing up, that was all I knew. Growing up, that was what my biological person taught me. So it was kind of a good thing that that was all I knew, because I trusted it more than somebody else who would never have used it. And I knew how to use it, and I just watched everything change day by day, every single day. And it's still does. Yes, ma'am. But like you said, it's not a cure-all for everyone. I work with a lot of different survivors nationwide. And I've talked to a lot of different caregivers nationwide, and a lot of caregivers have told me that they've tried CBD products and cannabis products for their survivor and had absolutely no use or help from it at all. And I always tell them that's because there's not enough research done on the body and the effects of the endocannabinoid system for them to understand how to appropriately give it to them for it to be beneficial for that survivor.
Right. And the issue with quality of products. So I've had clients who have come to me and said, oh, I tried CBD and it didn't work. And I said, well, let's take a look at what you were using. A guy in my pickleball group yesterday brought me a bottle of CBD and it was an isolate. I said, Jay, that's not going to do it for you. That is a cheap Bed Bath and Beyond, I mean, or go to the gas station. That's not where you should be buying your CBD. You need
Exactly.
high quality if you're going to use it as medicine. So, you know, people need a lot of education in the dosing. Maybe these people, when they said, oh, it didn't work, the quality of the product, was the dosing correct? Was someone guiding them? Because so few people know about this. So Jordan, your work, I am so excited to hear what you're doing, because that is just so important to bring this medicine and these, you know, this idea to, you know, to the people.
I'm doing the best that I can as a survivor. I wasn't taken very seriously for the first couple of years, honestly. But now that I have a huge picture falling into place for everyone to see, they can't deny what I'm doing.
That is incredible.
So the other thing that I want to quickly mention for everybody to just think about, because it's almost time to go. We're well past our typical 30 minutes, is the fact that the US government owns the patent on this. So to me, it seems really ironic that there is a fear, and I did have it edited in our blog, because until we have a little bit more information about the patent and clinical trials and universities being hesitant about that, we don't know enough about it, you know, fact checking, but that's something to be aware of, right? And so we need to start challenging these questions, just like I used this example before, just like the men marched on Washington to move the FDA with the HIV drugs and fast track that approach. So again, it's this unification of people's data and people's demands that if you keep asking for it, it will get answered. So that's what we're trying to do as a group, and make things different and make things better. I think that's all we have in terms of time. Do you want to put on the screen your
Can I answer one more question?
Sure.
Can I just answer one more that came through a DM? Daniel asked about Delta 8 THC, and is that what you mean by isolate? So an isolate product is just the single molecule. It's just THC, just CBD, without the other terpenes, flavonoids, all the other beautiful stuff in the plant that work together synergistically. So that would apply to a Delta 8. It's just a Delta 8 is, THC is typically Delta 9, and it's changed a little bit, Delta 8. I can tell you, Daniel, that there are a lot of issues with some of the Delta 8 products out there. They're finding that they're synthetic, and some of them have heavy metals. And so finding a really good quality Delta 8, it's not that there are some good things about Delta 8 THC, but you just have to be careful where you source it from.
Okay.
And if anybody has other questions, just shoot me an email. Okay, you know, stay in touch if you have questions, or, you know, Jordan, keep me posted on what you're doing. Are you in North Carolina? Is that what I heard?
Yes, ma'am. I am. And Lynn, will you connect us, please?
Yep.
Thank
I'll connect you guys. I'll do it right now.
And anyone
again,
can reach out through my website. You can, my email is on the website. So just shoot me an email.
And again, it'll also be information on the email that I send out when the webinar replay goes up to everybody. All right. Well, thank you, Janice. Again, you know, like I was as impressed the first time when we met, I would like to keep this conversation going. So everybody spread the word. Let's start making some positive moves to get people relief and on the road to recovery.
Great.
All right. Thank you for
Great.
joining.
Have a great day,
Thank you,
everyone.
Janice.
Okay.
Thank
Bye-bye.
you.
Take
Bye-bye.
care.
Bye.
Bye-bye.